ABQ Health Partners Cardiology is a cardiology group dedicated to taking good care of patients' hearts. We think it's most important to take care of the heart to ensure a healthy and long life. This is especially important since heart disease is the #1 killer in the United States. It's also one of the larger reasons why people as they get older can become disabled and decreased in their functionality. Heart disease is quite prevalent. It's the #1 killer and it affects 1 in 4 people as far as the death. What's sometimes misunderstood is that women get heart disease just as much as men, and so we really need to focus on educating the women. That's why we try to focus on education while we see our patients, educating them on their risk factors and giving them a good idea of what their true risk is. We try to educate people to really look at their risk factors. These include hypertension, diabetes, their smoking, exercise, and their weight. For the American Heart Association, we call those the Simple 7. If we can get people to reach their goals by age 50, they have every expectation to live another 40 years without heart disease. The first step is to take the visit to their primary care provider. Oftentimes they're the ones that start and initiate the evaluation for the risk factors. They'll check the blood pressure, they'll screen for diabetes and other risk factors for heart disease. If they find some high-risk features or abnormalities on the exam or on their EKG, they often will send them to us. Certainly we sometimes get involved in the hospital. 50% of people that come in with a heart attack have no previous chest pain or symptoms prior to their heart attack. So sometimes it's a more immediate experience where we see them in the emergency room and have to make some quick decisions. Otherwise, we often are seeing them as part of their health care plan provided by their primary care provider, period. We have a healthcare portal for our patients. It's under www.abqhp.com. Under that, our patients can look at their blood tests, their studies, and their clinic notes. It's also a good way to interact with their provider. They can send direct messages. So any patients that are at ABQ Health Partners can do that.